A little long, so I apologize. The Department of Health and Human Services today reached out to all Medicaid providers and gave us an update on Medicaid funding and where things are going for the next fiscal year. It's not good. They have cut 3% of all reimbursement rates for all services. That's healthcare, behavioral health, long-term care, nursing home care, child care, all of it. Everything got cut by 3%. But that wasn't enough to work with the budget that was given to them by the General Assembly. So they have a $319 million budget shortfall. So many programs also had an 8% cut instead of 3%, and some programs had a 10% cut. Here are some examples of the programs that had 10% cut. Inpatient healthcare stays, outpatient hospital stays, nursing home care took a 10% cut. PRTFs, psychiatric rehabilitation treatment facilities. I really need you to know those residential facilities, I said rehabilitation is residential, those facilities house individuals who have often cannot live on their own, have high levels of violence, and they're individuals that need high levels of supervision, medication, and support in order to be successful at all. And we cut funding to those facilities. Good call. 8% cuts to things like outpatient treatment, physician care. Specialty doctors got 8% cut to their reimbursement rates as well.
You did it. You built a successful business and made it look easy. But at U.S. Bank, we remember what...
Cutting the reimbursement rates is going to cause problems. Not here in Wake County, where I work, and not in Durham County, where I live. It is going to cause huge problems to the rural communities and counties here in North Carolina. In places where they already didn't have enough doctors, nurses, psychiatrists, therapists, all of those things, that there already weren't enough of those people in those areas to provide services. Now those individuals will no longer be able to bill Medicaid. It is also worth noting that roughly 3 million people are on Medicaid services, and most of that is spread out throughout the state. And a lot of those people are children. Now, DHHS was smart, and they made most of the cuts to the adult programs and kept all things related to child care under Medicaid limited to that 3% cut. So shout out to them for thinking of the kids, who are a majority of Medicaid recipients. But it is important to recognize that this policy is going to close places. It's going to close clinics. It's going to close private practice doctors, or like individual doctors' offices, outpatient primary care providers. Specialty doctors who already don't really work in these communities will have no incentive to travel out there and provide services, which means that there will be a drain of these skill sets from these rural communities. They will move into the cities where they can operate under private insurance or in private pay situations. This is going to be a disaster for the farming and rural communities in this state. It is also worth noting that the same communities that will be heavily affected by this were also the ones heavily affected by Hurricane Helene. We are, by policy, abandoning those people. You cannot just get a doctor to move to your community and then offer affordable services to everyone. That's not a thing that happens. Not because of how we've set up our healthcare system. That just doesn't happen. Which means that people will drive 100, 200, 300 miles to see a doctor. They'll drive to Mecklenburg County, to Wake County, to Durham County to see specialists. Imagine you have a loved one of yours that has a cancer diagnosis, and they have to drive 2 hours into the city to get their treatments and then 2 hours home. How much extra burden financially that puts on you as an individual, and how much more of a burden it places on the healthcare system. Not to mention the fact that many specialties in those counties already have 6-month wait lists. I have a person that I'm connected with that has been trying to see a gastroenterologist. Every person they've called, covered by their insurance, has a 6-month waiting list for a problem they need to be seen for now. Imagine how much worse that is going to get when all these rural communities don't have treatment providers to go to of any kind and have to come into the major cities for that. I need you to know something. Your taxpayer money is paying for Medicaid. And it is paying, you are paying for somebody else's health care. It is also worth noting that your health insurance premium is also paying for somebody else's health care. That is how health insurance works, but that's besides the point. But the reason you want this money spent is because Medicaid will dictate where the needs are. They do a gap analysis every year and say, we don't have enough doctors or treatment facilities in this area, and they will provide grants and funding to send people out there. And nonprofit organizations and other healthcare entities will take advantage of those grants and go provide healthcare services where they otherwise would not, because it's not financially viable without support from taxpayer grants. Okay? That's just the way that this works when it comes to providing healthcare in our system. The system needs some overhaul, but this policy is not going to fix anything. It's going to make it worse. One of the other areas, nursing homes took a 10% reimbursement rate cut. For-profit nursing homes operate on razor-thin margins. I knew somebody once who compared it to restaurant margins. Hey, tiny. Nonprofits also struggle to break even on a regular basis. Cutting those rates means that they're going to do one of two things. Number one, they're either just going to close outright. They're just going to shut their doors and sell the property. Number two, they're going to kick all their Medicaid clients out and refuse to take Medicaid clients and only take private pay. Fun fact, Medicare doesn't cover nursing home care. Okay? This is going to lead to elderly who are homeless that also have complicated medical conditions. It's going to fill up the hospitals. As I mentioned, rural hospitals probably will start closing or have a reduced number of beds because they won't have the providers they need to operate or the funding they need to operate. This is a disaster for rural healthcare here in North Carolina, and particularly in areas hit by Hurricane Helene. This is a foolish policy. I will illustrate how foolish it is by telling you about a problem. There was a pilot program being funded by Medicaid and DHHS under a federal grant. That program was determining how to administer Medicaid services more efficiently. And they were saving $1,000 per person per year for every recipient on that program.
A Chewy order is on the way for Jaws, who never lets go of what he loves.
They were going to take their learnings from that and apply that to Medicaid as a whole, which would have saved millions of dollars per year. And they just cut the funding for that program in its entirety, and then cut funding for Medicaid services. It is also worth knowing that this current budget shortfall is not yet connected to the federal budget that passed recently. Those cuts are still also coming in 2027. Most Medicaid providers like my program and others are going to be able to navigate the waters for the next fiscal year, but in the year 2026 to 2027, you're going to see providers get cut out, quit doing Medicaid, stop taking Medicaid contracts, and you're going to see Medicaid providers shrink up, and they're all going to escape to the private healthcare system, which is more expensive. Which means healthcare as a whole is simply going to become less accessible and more expensive for everybody. I don't like to attack too many politicians when I talk about this stuff, but the reality is Republican politicians have been pushing for this kind of change for some reason I don't understand. It is bad public policy and will lead to a collapse of our rural healthcare system and overstress and overstrain the urban center healthcare systems. This is going to hurt everybody in the state of North Carolina. It's bad policy, it's a bad move, and quite frankly, it's foolish. Please stop voting for politicians of any party that do not understand the difference between good policy and bad policy, and simply vote for what they think is going to get them reelected. That's all I've got.
Really quickly, because we're running out of time here.